Do people tell you that you look tired in spite of you being fresh? In spite of you having sleep, still people tell you that haven't you had proper sleep? And it is all because of the under eye dark circles or because of the hollowness under your eyes? If this is your problem, this video is for you. Hello friends, I am Dr. Ankit Gupta. I am a plastic surgeon and I practice at Panache Aesthetics, Pitampura, New Delhi. Friends, today we'll be discussing a case of under eye hollowness and I'll be discussing a real life story of a patient who came to me for the same issue that you are facing. So guys, this beautiful young girl came to me with the issue that she, in spite of sleeping 8 hours a day, in spite of consuming healthy food, drinking plentiful of water, had these hollowness under her eyes, and people used to ask her that has she slept properly, is she suffering from anything, is there something wrong with her. So when she came to me, she was actually very much worried about this and wanted a permanent solution to this. She had done her research and had seen our videos on fat grafting and fillers that we regularly make, and because we regularly do blepharoplasty surgeries and periorbital rejuvenation, she found us on YouTube and came to see me. Her major issue was that in spite of using all the possible creams, all the homeopathic and Ayurvedic treatments and all the natural means, she was not able to get rid of this hollowness that she had developed in her under eye area. So this day when she came to me, I examined her and what I saw was that in her history, she had absolutely no illness. She was consuming healthy food. She was living a healthy lifestyle, but in spite of all that, she was having this under eye hollowness. And what we noted was that it was because the fat has shifted from above to below. And I told her that this can happen to many. And this was genetic in her case. Even her mother had the similar issues. In her family, this fat pad used to shrink a little bit earlier than the others. She, in spite of being only 28 years old, this fat pad has shrunk like a 35 or a 40-year-old, and this made this area look completely hollow. I explained her that all this is because of the fat pad, the cheek fat pad that has shifted below, and there is hollowness over here. So what happens is, because of this hollowness, there is shadow of your eyes that falls over there, and because of that shadow, that area appears to be completely dark. It's similar to a hole. In spite of painting the hole white, it will always look black because light does not reach that area. Similarly, if you have a hollow in this area, to get rid of this dark circle, you have to fill it. So we discussed with her possible options, and the possible options were either go with a filler, which is synthetic and you have to repeat it every 1 yearly, or with a more natural way, that is fat grafting. Now, as soon as I said fat grafting, she had the usual doubts which every patient of fat grafting would have. The 3 major doubts. Number 1, how long will it last? Does it really last a lifetime? Because what she had read was that it doesn't. The second, will it leave lumpy bumpy appearance? And the third, if it is that good, why don't people talk about it? So, to answer her queries, number 1, yeah, it is permanent, but you need to understand that only half or less than half of whatever I fill will survive for your life. So, what happens is, when I take out fat from either your tummy or your thighs and I process it into micro and nano fat, I then inject it into the pre-marked areas. When I inject it to that area, only half of whatever I inject will take. You need to understand that this is a live tissue. Fat is your own body's live tissue. It is your natural fat. When I inject it to that area, only less than half of what I will inject will survive and will take. But once that fat has taken, it will be there like your natural fat. Now, if you gain a little bit of weight, this will also gain. If you lose weight, it will also get long. But you need to understand this is your tummy fat. So for it to become double, you need to make your tummy double. And for it to become half, you need to reduce your weight by half. So it is more or less stable only if you maintain your weight within a range of 5 kgs. So she was able to understand what fat grafting is now. The other doubt that she had was, will it be lumpy bumpy? So what we do is, we take out the fat through very small cannulas so that the fat cells that we get are very small ones. We do not take out big chunks of fat. So the lipo aspiration that we are doing is through a very fine cannula, which is 2.5 millimeters only. Now, once we have harvested that fat, we make sure to wash off all the blood and the fibrous tissue from that fat so as to separate out the good fat that is there in it. We also use the method of centrifugation to separate out only the pure fat cells, and we try to remove all the water that we had injected in her tummy. Once that is done, this fat cell is transferred into single ml syringes, and we use only half a ml of fat in each syringe, and that fat is then carefully injected into the tear trough area. Now we make sure to break down this fat into micro fats. So when we break down this macro, that is the bigger fat, into micro, that is the smaller fats, I can now control how much fat I am injecting, and I will be putting very small liquids of fat, and I will be spreading it not just in the tear troughs, but I will be giving you fat in the tear trough as well as in your cheek areas, as well as a little bit in your temple areas. What this does is it will make a smooth transition from your eyelids to your cheeks, so that there is no lumpy bumpy appearance that remains. And since we are putting very minute quantities at every drop, it will never give a lumpy bumpy appearance. And the most important part is we never fill it beneath the skin. We try to fill it just above your bone. So to make the point, you have to remember, for the fat grafting to give a very good result, the surgeon has to be experienced in tear trough fat grafting, and the fat grafting has to be done in a certain way. It is not similar to how you do fat grafting in the breast or the buttock area. Now, once that is done, it will swell up, and the swelling will take almost 2 weeks to settle, and the final result is visible only after 2 to 3 months. Now, why does this happen? So initially when we inject fat, what happens is this whole area will swell up. But as I have already told you, only less than half will survive, and it will take almost 3 months for everything to settle down. But the initial swelling of the surgery will be there for about a week or two. So in about a week or two, you should be healthy enough or good enough to join back your social life. So what happened with her was that we did her fat grafting finally, and we had discussed all the options. We combined this fat grafting with microneedling. So the advantage of doing fat grafting is that we can combine it with multiple treatments. We can further break down this fat into nanofat, and this nanofat has stem cells, which are adipose derived stem cells, which can be injected in the skin or can be used along with microneedling to rejuvenate the skin over the cheeks. This will not just tighten the skin, it will also induce collagen formation, elastin formation, and will deliver stem cells to rejuvenate this whole area. So we combined fat grafting with microneedling and nanofat. We can even combine it with CO2 fractional laser, but in her case we did not do it because she was a little bit on the darker complexion. For those who are skin type 1, 2, that is they are fairer, we will preferably opt for CO2 fractional laser, which can even tighten up the skin. So in her case, this is her result immediately after, and this is how the swelling happens, and this is her after about 3 weeks. She was really happy, and after about 3 months she has shared her pictures with us. So her procedure took about an hour. We took out fat from her tummy and injected into the cheeks as explained, and in the post-operative period, she was discharged immediately after because this was done under local anesthetic. You don't have to go under general anesthesia, and you can be discharged within an hour of your surgery. You have to wear a pressure garment on your tummy from where we have taken out fat for about a week. You will develop swelling in the face for about 7 days to 14 days. You need to apply arnica and other medications to decrease the bruising, and you have to take antibiotics and painkillers for about a week's time. She recovered completely within 2 weeks, and she was able to join back her work after 7 days. Since she was doing online work from home, she was able to start her work from day 3, but she was able to go back to her office within 10 days of the surgery. This is her result at about 3 months, and she was really happy with her results, and I was very satisfied with the result. The major advantage was that this is not a filler. It is not like a rental service that you have to keep doing again every year. This is something which is very permanent, and I prefer to fill a little bit less so that if it is not adequate, you can always come back for a second sitting anytime after 6 months. But if I fill more, it is very difficult to remove. So I would always prefer to fill a little bit less. Although she was happy with what we had filled, and I don't think she'll need another sitting. She is happy, I am happy. Hopefully this video is something you can relate to, and if you have something similar to ask, you can always get in touch with us at Panache Aesthetics. Thank you and have a nice day.